It was 11:47 at night when Celeste Odum finished mopping the third-floor hallway of Hargrove Medical Center. She always worked in the quiet hours, not because she preferred the dark, but because the day shift meant navigating around doctors and their carts and their looks, the particular kind of look that passes through a person's eyes when they see someone in a gray uniform pushing a mop bucket and decide, in less than a second, that there is nothing more to see. Celeste had learned to make herself small in those moments. Not invisible, that was never quite possible, but small enough to pass without friction. She wrung out the mop, moved the bucket forward 3 feet, and kept going. The hospital smelled like antiseptic and the faint trace of cafeteria food that never fully left the ventilation system. She had memorized every sound the building made at this hour. The elevator hum on the east side, the printer that kicked on at midnight in the billing department, the way room 314 had a loose ceiling tile that rattled when the HVAC cycled. She knew this building better than most people who had their name on the wall. That thought used to make her laugh, in the bitter way that isn't really laughing. Now it just felt like a fact. Celeste was 31 years old. She had a younger brother named Deshaun who had been in a wheelchair since he was 19. A car accident that left him with a spinal cord injury and a medical debt that had, in the years since, become the organizing principle of both their lives. Their mother, Wanda, had worked 2 jobs until her knees gave out. Celeste had stepped in at 23 and never stepped back. She had 1 semester left of her nursing program when it happened 1 semester. She had dropped out with the intention of returning the following year. That year became 2, 2 became 4, and somewhere in there, Celeste stopped telling people she was planning to go back, because the way their faces softened when she said it. That particular mixture of pity and doubt was worse than saying nothing at all. She got the job at Hargrove because it was the closest large hospital to their apartment, and because the night shift paid a differential. She mopped floors, she emptied biohazard bins. She restocked supply closets and wiped down surfaces, and sometimes, when she was certain no one was watching, she stood outside the break room and listened to the nurses talk through their cases. She listened a lot. That was the thing nobody knew about Celeste Odum, the listening. She had kept up with her coursework. Not officially, not enrolled anywhere, but she had a library card and a subscription to a medical journal database that cost her $42 a month, which was money she probably should have spent on other things. She read. She took notes in a composition notebook that she kept in her locker. She thought about cases the way some people think about crossword puzzles, turning them over in her mind on the bus ride home, looking for the piece that didn't fit. It wasn't a hobby. It was the only part of her life that still felt like it belonged entirely to her. The night everything changed started like every other night. She had been called to clean up a spill on the 4th floor, near the cardiac unit. Someone had knocked over a pitcher of water near the nurse's station, and the charge nurse, a compact woman named Gail, who had worked nights for 15 years and had the kind of efficiency that bordered on military, had called housekeeping without looking up from her computer. Celeste came. She cleaned it up. She was on her way back to the elevator when she heard the voice. It was coming from the conference room at the end of the hall, the one they used for case reviews and resident teaching sessions. The door was halfway open, and the light inside was bright and flat. She recognized the voice before she recognized the words. Dr. Aldrich Fenn. Everyone at Hargrove knew Dr. Fenn. He was the head of the cardiac diagnostics department, which meant, in practical terms, that he was the person who got called when other people couldn't figure out what was killing someone. He was 54 years old, had published more than 60 papers, and had a reputation for being brilliant in the way that certain men are allowed to be brilliant, loudly, with the assumption that the room should adjust to them rather than the other way around. He had a way of walking into spaces that made other people instinctively shift aside. Celeste had never spoken to him directly. She had cleaned his office twice when he wasn't there. She slowed down near the door. Inside, she could see the edge of a projected slide on the wall, an ECG readout, leads labeled in the standard configuration. A tracing that even from the doorway looked unusual. There were 4 or 5 residents sitting in a loose cluster of chairs. One of them was taking notes. 2 were watching Dr. Fenn with the focused attention of people who understood their career advancement was somehow always being observed. This is the case, Fenn was saying. 47-year-old male, admitted this morning with chest pain and shortness of breath, troponin, negative. No ST elevation. His primary resident called it anxiety and sent him back to the waiting room. A pause. That patient coded in the waiting room 40 minutes later. He is currently in the ICU. The room was quiet. Someone tell me what was missed. One of the residents, a young man with wire-rimmed glasses, offered something about left bundle branch block. Fenn dismissed it with a gesture that wasn't unkind exactly, but wasn't kind either. Another resident mentioned Welland's syndrome. Fenn turned back to the slide, closer. But look at the T waves in V4 through V6. Look at the axis. Tell me what you're seeing. Nobody said anything. Celeste stood in the hallway with her mop bucket and looked at the slide. She saw it. It was there in the pattern of the tracing. The subtle, easy-to-miss sign that wasn't quite Welland's, wasn't quite LBBB, but was something that appeared in the literature in a specific combination with a specific history. She had read about it. She had read about it in an article that had been published 14 months ago in a cardiology journal, a case series out of a hospital in Cleveland, and the authors had flagged it as underdiagnosed precisely because it mimicked more common presentations. She knew what it was. She also knew she was holding a mop in a gray uniform in a hallway she had no professional standing to be in. She kept walking. The next morning, she was back. Day shift on the first floor, near admitting, which she didn't usually work, but which had needed coverage. She was wiping down the check-in counter when she heard one of the administrative nurses mention the patient from the night before. Still in the ICU, they said, not improving. The team still debating the underlying cause. She went back to her locker on her break. She got out the composition notebook. She wrote down everything she remembered from the slide, the lead configurations, the T-wave morphology, the axis deviation, and then she wrote down the name of the article, the authors, the journal, the volume number. She had a good memory. It was one of the things she had never found a use for, in the life she was actually living. She stared at the page for a while. Then she tore it out, folded it once, and put it in her. She almost didn't say anything. That's the part that doesn't make it into the versions of stories like this that people like to tell. They skip over the part where the person with the answer stands at the edge of saying it and calculates, very quickly and very accurately, everything they stand to lose. Celeste had calculated. She was not a nurse. She was not a doctor. She had no license, no credentials, no institutional role that gave her the right to walk into a clinical discussion and offer a diagnosis. The best-case scenario, if she was right, was that she would be thanked quietly and then forgotten. The more likely scenario was that she would be looked at the way people look at someone who has forgotten their place, not with anger, but with the particular patience of someone waiting for an inconvenience to resolve itself. The worst case was that she was wrong. That thought almost stopped her. She thought about Deshawn. She thought about the way he had looked at her the last time she visited, when she mentioned she was still reading, still keeping up. He had nodded slowly, and then he had said something she hadn't forgotten. "You're the smartest person I know, Celeste. I just need you to know that I know that." He didn't say it like a compliment. He said it like a fact he had been carrying around and finally decided to set down. She unfolded the piece of paper. She found Dr. Fenn in the hallway, outside the cardiac unit at 9:15 in the morning. He was with 2 residents. He was mid-sentence when she stepped into his path. Not aggressively, not blocking, but enough that he would have to see her. He stopped. The resident stopped. Fenn looked at her the way a person looks at something that has interrupted a pattern. It wasn't hostile. It was the look of a very busy man whose mental model of the world did not have a slot for this particular interaction. "Can I help you?" he said. "I think it might be the other way around," Celeste said. Her voice came out steady, which surprised even her. One of the residents almost smiled. Fenn's expression didn't change. "I'm sorry?" "The patient in the ICU," she said. "The one from last night. The ECG on the slide. I was in the hallway during your session. I saw the tracing." She held out the folded paper. "I think I know what it is." There was a silence. It was not a comfortable silence. Fenn looked at the paper. He did not take it. He looked at her uniform, at the small plastic badge on her chest that said Environmental Screvifice, at the mop bucket she had by instinct parked 3 feet behind her. "You were in the hallway," he said. "The door was open. And you," he paused. Something moved behind his eyes. "You believe you identified a cardiac presentation." The way he said it was not a question. It was the verbal equivalent of taking a step back. creating distance, establishing, with tone, what the conversation was and was not. Celeste kept her eyes level. I believe I recognized a pattern. There was a case series published 14 months ago. 14 patients with a presentation that fit what I saw on that ECG, the T-wave morphology in V4 to V6, the axis, the history. 3 of the 14 were initially misdiagnosed as anxiety or atypical angina. All 3 had the same underlying cause. She unfolded the paper and held it so he could read it without taking it from her. He didn't look at the paper. He looked at her. "What is your name?" he said. "Celeste Odum. And you work for Environmental Services?" "I do." He said nothing. Behind him, one of the residents, a young woman with her hair pulled back, whose name badge Celeste had never learned, was looking at the paper in a way that was different from how Fenn was looking at it. "Dr. Fenn," Celeste said, and she kept her voice very careful, very even, because she understood what she was doing in this moment, and she understood the risk, and she had decided to do it anyway. "I'm not trying to practice medicine. I'm not telling you what to do. I'm telling you there's a paper you may not have seen, and there's a pattern in that ECG that I recognized from reading it, and there's a man in the ICU who has been there since last night. I thought that was worth 30 seconds. She set the paper on top of his patient chart, and then she picked up her mop bucket and walked away. She spent the rest of the shift waiting to be fired. She was not fired. She was also not contacted, not thanked, not told anything. The day passed the way days do, and she went home, and she helped Deshaun with his dinner, and she sat on the couch afterward and read the same page of a book 4 times without absorbing any of it. She fell asleep in the chair. When she woke up, it was 2 in the morning, and her phone had a voicemail from a number she didn't recognize. She sat up and listened to it. It was the resident. The young woman with her hair pulled back. Her name was Dr. Odum, and her voice on the recording was careful and professional, and underneath that, unmistakably, there was something else. Something like barely contained. "Mrs. Odum, this is Dr. Odum from Hargrove's cardiac unit. I looked up the paper you referenced, and I brought it to the attending this evening. We ran additional imaging and changed the treatment protocol about 2 hours ago. The patient is responding. He's actually responding." A pause. "I don't know how to say this correctly, but I wanted you to know. I'll be in the hospital tomorrow I just wanted you to know." Celeste listened to it twice. Then she set the phone down on the coffee table and sat very still in the dark apartment. Deshaun was asleep. The refrigerator hummed. Outside, a car passed on the street below, its headlights sliding across the ceiling. She did not cry. She thought about the equation she had been solving in pieces for 8 years. The one that had no clean answer. The one that asked how much of yourself you could redirect towards someone else's survival before the remainder stopped being enough to live on. She had been so focused on the math of it that she had almost forgotten there was another question underneath it, the question that had nothing to do with what she owed and everything to do with what she was. She already knew the answer. She had known it for a long time. She just hadn't let herself think about it directly. 3 weeks later, she was called to Dr. Fenn's office. She had been expecting it, in the abstract way that you expect something you cannot fully prepare for. She changed into her cleanest uniform. She left the mop bucket by the elevator. His office was on the 5th floor, facing east. There was a window that looked out over the parking structure. On his desk, between stacks of journals, there was a framed photograph of a cardiac anatomy model that he appeared to have printed and framed himself, which she found, for some reason, humanizing. He was sitting behind the desk when she came in. He gestured to the chair across from him. She sat. He looked at her for a moment without saying anything. He had the look of a man who was used to conducting conversations and was currently in one that had stepped outside the territory of his preparation. "The patient," he said, "was discharged 4 days ago. He's recovering." "I'm glad," Celeste said. "The presentation was consistent with what you described. A variant of coronary vasospasm with a specific morphological signature. It's not well known outside the research literature. The paper you cited was the primary source." He paused. Dr. Odum flagged it. The attending on call made the call to adjust treatment. He said all of this factually, accurately, in the way of a man giving credit where it was due while also maintaining the exact contours of institutional reality. Celeste waited. "I want to ask you a question," he said, "and I want you to answer it honestly." "All right. How did you come to know that paper?" She could have hedged. She could have said, I came across it, or I happened to read it, or any of the small diminishments people use to make themselves more comfortable to be around. She had spent years making herself comfortable to be around. I've been reading, she said. Formally, I was enrolled in a nursing program. I had 1 semester left when my brother's accident happened and I had to leave. I've kept up on my own since then. Not officially, just reading, taking notes, keeping current. She met his eyes. I've been working here for 6 years. I know more about what goes on in this hospital than most people with a badge that opens the important doors. That's not a complaint. It's just true. Fen was quiet for a long moment. Then he leaned back in his chair and he looked at her with an expression that was difficult to categorize. It wasn't guilt, exactly. It was something more complicated than guilt. The look of a person re-encountering something they had sorted incorrectly and can no longer pretend they haven't noticed. I owe you an apology, he said. It was not what she had expected. The way I responded in that hallway was not appropriate. I treated your information as a disruption rather than data. That was a failure of judgment on my part, and it could have had consequences. A beat. It almost did. Celeste said nothing. I've spoken with the nursing program director at the University of Western Maryland, he said. They have a partnership with the hospital, Employed Learner Track. If you wanted to complete your degree while continuing to work here, there's a pathway. The department would cover tuition for clinical staff in good standing. He paused. I don't know if that's something you want, but I wanted you to know it exists. She thought about Deshawn. She thought about the $42 a month she spent on journal access. She thought about the composition notebook in her locker, full of notes no one had ever asked to see. I need to think about the logistics, she said finally. Of course, but yes. She held his gaze. That's something I want. She didn't go straight home after. She took the long way, down the back stairwell, through the first-floor corridor, past the supply closet she had restocked so many times she knew exactly which shelf the extra IV tubing lived on. She walked through the building the way she always walked through it, in the unhurried way of someone who knows every corner of a place. But something was different. It wasn't the building. The building was exactly what it had always been. The antiseptic smell, the elevator hum, the loose tile in 314. What was different was the way she moved through it. Like someone who had decided something. Like someone who understood, finally, that knowing a place from the inside didn't make you part of the furniture. It made you someone who had been paying attention for a very long time. And attention, applied correctly, turns out to be one of the most dangerous things in the world. She pushed through the back door and stepped into the evening air. Her phone buzzed. It was Deshawn. A voice message which was unusual. He usually texted. She pressed it to her ear. Hey, I don't really know why I'm calling. I had this feeling today. Like something good happened. Did something good happen? She stood on the sidewalk outside Hargrove Medical Center and looked up at the 5th-floor windows. She thought about a man she had never met who was home with his family tonight because of a paper she had read at midnight in her apartment, because she had refused to stop learning even when the world had given her every reasonable excuse to. She called Deshawn back. Yeah, she said when he picked up. Something good happened. She didn't explain everything. Not then. She just stood there in the cooling air and talked to her brother, and there was something in her voice that he heard immediately because he was quiet for a moment, and then he said, I knew it today. And that was enough. That was more than enough. There's something worth holding on to in a story like this. Not because it ties up neatly, because it doesn't, not really. Celeste still had bills. Deshawn still had appointments. The world was still exactly as complicated as it had been the morning before. None of that changed. But this is what did change. A woman who had spent 8 years being looked through had, in 30 seconds in a hospital hallway, decided she was done being overlooked. Not loudly, not dramatically. She just held out a piece of paper and spoke clearly and didn't shrink when someone tried to make her feel like she was in the wrong corridor. That's it. That's the whole thing. People like to imagine that moments like that require some extraordinary burst of courage. Some internal transformation, some switch that flips. But the truth, if you've ever lived inside a story like this, is that the courage was already there. It had been building in a composition notebook $42 at a time for 6 years. She wasn't ready because something changed. She was ready because she had never stopped preparing, even when preparing seemed like the most pointless thing in the world. There is something undefeatable about a person who keeps learning in the dark, who keeps showing up, keeps paying attention, keeps caring about something beyond the edges of what they've been allowed to have. You can overlook a person like that, but you cannot make them disappear.